The Kenya Union of Clinical Officers Kuco has temporarily called off its nationwide strike for 21 days to facilitate negotiations with the Ministry of Health, the Council of Governors, and the Social Health Authority (SHA). This period was requested by stakeholders to finalize a return to work agreement. Our reporter Florence Simiyu with more insight to that story.
The dispute between clinical officers and the government has temporarily resolved with a 21-day suspension of strike notice to allow further negotiations. The union's 14-day strike notice issued earlier this week has been put on hold following key agreements. Among the resolutions, the Social Health Authority will be reinstated in all facilities, and clinicians previously locked out will return to ensure uninterrupted service delivery. This decision has been endorsed by the Ministry of Health.
Even though we have come to an agreement and the issue of SHA is being sorted, there is need to relook into the people who are actually implementing the policies in that SHA board. Because if people with full understanding can make policies that sabotage the health of Kenyans, those people do not deserve to sit in those positions.
Additionally, the Council of Governors has pledged to engage the National Treasury to secure permanent and pensionable terms for clinical officers, addressing a primary demand by the Kenya Union of Clinical Officers.
We have been raising the issue that they are being discriminated, and the terms that they are working in is discriminative in nature, and they are being paid peanuts.
However, some counties including Vihiga, Lamu, Kwale, and Uasin Gishu are exempted from the agreement. Other counties yet to comply with the return to work formula include Kakamega, Bungoma, Nyandarua, Kirinyaga, Kisumu, Kiambu, Homa Bay, Mandera, Garissa, Tharaka Nithi, Laikipia, Isiolo, and Marsabit.
We are going to give specific counties their notice for 7 days or 14 days as members shall agree, so that we commence an industrial action in those specific counties. For the one that I have mentioned, they are already going on, and we are not stopping them until they are fully handling.
The Kenya Union of Clinical Officers has also issued a notice to Kenyatta National Hospital, accusing it of subjecting its staff to poor working conditions and demanding immediate corrective action. Reporting for Tandao News Outlook at 1, I'm Florence Simiyu.